Good morning, I'm Kelly Rose Thomas. I'm a doctor of physical therapy, a triathlon, cycling, and pregnancy and postpartum athleticism coach. I put together this video for athletes, coaches, and healthcare providers that want to learn more about the pelvic floor and how to contract and relax the pelvic floor muscles. This video is educational. It is not to diagnose or treat any pelvic floor dysfunctions. I'll post a link at the end of a directory if you need to see a pelvic floor specialist so you can find one in your area, and some other resources. So first, let's start off with a brief overview of a pelvis. We're going to use a female pelvis for today. Okay, so let's look at first the structure. So we have our bony pelvis, and this is supportive in nature, okay? For pelvic organs, the muscles, the connective tissue, it also provides a dynamic link between the spine, which we see here, and the lower extremity. So I left the underwear on here so you could see this is where your leg bone attaches to the pelvis. So we have ligaments also. Here we can see them in white, a little bit hard maybe on the video. They have some different functions, but primarily they are here to support and help contribute to the support and the stability of the pelvis. We're not able to contract our ligaments like we are our muscles, and we'll talk about those in just a moment. Here we have some of the superficial structures. As we head a little more south, we have the urogenital triangle here, which is just like it sounds, urine and genital region. We also have the anal triangle region at the bottom here, and in between the two of those is a perineal body, so right here. This is going to come into importance a little bit later when we talk about performing a kegel and something that you can look for to see if you're performing one correctly. With our pelvic floor muscles, we have superficial muscles. They're primarily involved with sexual function. And then we have our deep pelvic floor muscles, and that's what we think of when we consider performing a pelvic floor muscle contraction or a kegel. So deep inside the pelvis, you can see here, there's several muscles in there, a group of muscles called the levator ani, as well as the coccygeus. We also have nerves, arteries, and veins in the pelvic region, just like everywhere else in your body. So that's the basic overview of the structure. In terms of function, what does our pelvis do? It has a sphincteric function, so it controls continence, so we don't leak urine or stool. Supportive function for the abdominal contents, the pelvic organs, as well as the connective tissues in that area. So I'm going to get the pelvis again, and I'm going to add a abdominal cavity. We're going to use a balloon as a model. Our abdominal cavity is not filled with air, but let's add this here. Okay, so it helps support this abdominal cavity. It's also, the pelvic floor muscles are also involved with stability and posture. Our pelvic floor muscles contract before almost every movement that we perform to assist with that core stabilization. Pelvic floor muscles are involved with respiration. So I have my balloon labeled here. I'm going to take it off of here for just a moment. Our pelvic floor muscles sit at the bottom here. Okay, when we inhale, our diaphragm, which separates our thoracic cavity with our lungs and our heart from the abdominal cavity, our diaphragm is going to drop down. Okay, so we see our diaphragm here. It's going to drop down when we inhale, right, to allow more room for our lungs to expand. They need to expand. So this is going to drop down. Our diaphragm will drop down, and our pelvic floor muscles are going to lengthen. So we inhale, diaphragm drops down, pelvic floor muscles lengthen or relax. And then when we exhale, the diaphragm can move back up and our pelvic floor muscles contract to help with that respiration. It moves in this motion. Diaphragm drops down, pelvic floor muscles also drop down, and then we exhale and everything moves up, very similar to a piston function. Pelvic floor muscles are also involved with sexual function, as well as act as a sump pump for lymphatic drainage. Pelvic floor muscles are skeletal muscles. They, just like our bicep, okay? Skeletal muscles. We are able to contract our pelvic floor muscles. We can strength train them. We can improve their endurance and improve their coordination. They are 70% slow twitch and 30% fast twitch. And they're, again, under our control, so we can contract and relax our pelvic floor muscles. We can have dysfunctions of the pelvic floor. Again, this is not to diagnose or treat, but we can have underactive pelvic floor muscles. So an inability to perform a strong contraction. This can result in maybe a prolapse or a incontinence, we'll talk about in just a moment. We can have overactive pelvic floor muscles, so muscles are unable to relax. They stay in that contracted position. Imagine if you were walking around with your bicep contracted all the time. That's not normal, right? It's overactive, it's always contracted. Some individuals experience that in their pelvic floor. Our pelvic floor muscles can be uncoordinated, and we can also use a lot of substitution methods, so we can contract other muscles instead of contracting our pelvic floor muscles. So what are some of the signs and symptoms that someone with conditions of the pelvic floor might experience? This goes back to the function. So remember, we talked about that sphincteric or that continence function. Someone with a pelvic floor dysfunction, they might leak urine or leak stool. We talked about supportive function. Well, an individual with a pelvic floor muscle dysfunction, they might have pelvic organ bulging or pressure in that region. Pelvic pain and sexual dysfunctions are also some conditions that are associated with the pelvic floor. Okay, so causes. Rarely is it just one cause, so we're looking at multiple factors. Childbirth can be problematic, if you will. It's a trauma, whether the baby comes out of the vaginal canal or cesarean. But we're also seeing pelvic floor dysfunctions in middle school athletes who have never given birth. So it's not just due to childbirth. Advanced age, as we get older, we have changes in skeletal muscles. We just talked about how the pelvic floor muscles are skeletal muscles. So some changes with aging. Hormonal changes affect pelvic floor muscles. High BMI, so high body mass index, can cause extra pressure on the pelvic floor muscles. High impact activities as well. Trampoline. We have reports of a lot of individuals who do trampoline and experience incontinence. And side effects from medications as well. Okay, so let's talk about a pelvic floor muscle contraction and what it is and who it might be appropriate for. So someone that has an underactive pelvic floor, maybe a weak musculature, they might leak urine when they cough, for example, or walking uphill. If they're returning to running postpartum, they might experience this disorder of the underactive pelvic floor However, I have to caution you because someone postpartum returning to running who leaks urine, it might not be due to an underactive pelvic floor, it might be due to an overactive pelvic floor. So we talked about how muscles should be able to contract and relax. Okay, someone with the overactive pelvic floor, the muscle stays in a contracted position. Well, they're not able to relax it. So their muscle is, if you're walking around with your bicep contracted the whole time, all day, right? And then you try to load it, pick something up, your bicep's gonna be really, really tired. Same thing for someone with an overactive pelvic floor where their pelvic floor muscles are tight, and then you add the stresses of running. They could still leak urine. So this is where a pelvic floor specialist is really important to help determine if it's underactive pelvic floor, overactive pelvic floor, and they can do that by performing an internal exam. Pelvic floor muscle contractions may not be appropriate for someone who is under pelvic rest. So after surgery in the pelvic region or childbirth, usually 6 weeks, it's not appropriate to perform a pelvic floor contraction. And then it used to be recommended to try to contract your pelvic floor while you were going to the bathroom, so midstream of urine. And if you were doing a good pelvic floor contraction, then you'd be able to stop the flow of urine. We're not recommending that. I'm not recommending you do that at all. Don't mess with toileting. Just go to the bathroom and don't mess with it. Okay, so pelvic floor muscle contraction. It's a contraction of those deep pelvic floor muscles. And what you're attempting to do is squeeze your openings closed. Okay, so your vaginal, your anal opening, go ahead and squeeze those closed and then lift. So the pull of the muscles, the pull of these muscles is going to be up towards your head. Okay, so it's a squeeze as well as a lift. So it's like you're trying to pull your underwear in. You are trying to stop the flow of urine, although we already talked about don't actually try that, but just imagine you're trying to stop the flow of urine or hold back gas during a pelvic floor contraction. Some common errors, instead of squeezing and lifting, some people do the opposite. They bear down, and we're going to talk about that in just a moment as a substitution. Another error is straining or co-contracting other muscles in the area to substitute. So our adductor muscles in our inner thigh, they actually insert onto our bone here. And so instead of contracting our pelvic floor muscles, we squeeze our legs together or squeeze our butt muscles, okay, on the back side, our glutes, or squeeze our abdominal muscles up here. Okay, so those are some substitutions when trying to contract your pelvic floor. But a true pelvic floor contraction or kegel is a squeeze and a lift. So how do we know if we're doing it correctly? Well, you can use a mirror. So you can do this with your underwear on if you're more comfortable. I'll put the underwear back on my model. And earlier when I was showing you the structure, I talked about that perineal body between the vaginal opening and the anal opening. Well, we can look for that, right? If you do a contraction, you should be able to see your underwear go up towards your head, and then when you relax, your underwear will go back out. So you can use a mirror and you can look there, underwear on or underwear off. You can also use tactile. So you can use your finger, wash your hands, put your finger inside your vagina and feel for that squeeze around your finger and lift towards your head. If you don't want to use your finger, you can use a tampon. right? You can insert the tampon applicator and leave it there and perform your pelvic floor muscle contraction. You can squeeze around the tampon and see if you can feel it lift towards your head. You can ask your partner during sex if he or she feels a squeezing around their body part or their finger. So again, that's squeeze and lift. And then if you go see a specialist, they have other tools in the clinic to also see if you're able to perform that squeeze and lift. And if you're not, then they have tools that can help with that. But remember, it's also very important to be able to relax the muscle. So you want to be able to see or feel that squeeze and lift, but then the muscle needs to be able to relax. We can't just keep it in that contracted position all the time. It wears the muscle down. It's an endurance, those are endurance muscles, but they're gonna get tired as well. Well, I hope this was a helpful overview of the pelvic floor, the structure, the function, as well as how to perform a correct pelvic floor contraction and the importance of a relaxation of the muscles. Go ahead and post your comments or questions in the comments section. You can send me an email at kelly@peregrineendurancesports.com if you have other questions. Thank you for your time and attention. Have a great day.